I asked if you would come up because I'm ready to do what's called an upper blepharoplasty. And I've been talking about it for probably 18, 20 years. I mean, it's a gradual process, and so it's not necessary. I was walking around my office, and my staff was telling me that I'm looking old and tired. So Hope, our doctor, nursing practitioner, did a little CO2 laser resurfacing on me in October. So like most of our patients, you start looking in the mirror and, well, that looks smoother. All of a sudden you notice the next thing, and the next thing for me were my eyelids. And I don't know, I'm ready for a little pick-me-up. So I sound just like patients. So I love blepharoplasty. I love eyelid surgery. I think it's one of the best things anybody can have done in their lifetime. Perhaps not everybody's a candidate, but almost everybody is. And so I'd like to talk to you and hear a little bit about blepharoplasty. First of all, just give me your overall thoughts on upper eyelid surgery.
Yeah, so why do we do upper eyelid surgery? Upper eyelid surgery is primarily done to remove skin. Sometimes people will have a little fullness towards the nose and we'll remove a little fat. But again, why do people need it done? For excess skin. And it can for aesthetic reasons, but when it goes further, it can actually interfere with vision. Interestingly, the operation's the same, whether it's a functional patient for visual field loss or an aesthetic patient, just I don't like the look of my eyelids. The procedure itself is the same, and both sets of patients receive both benefits. So all functional patients will receive a functional benefit, but also an aesthetic benefit, and all the aesthetic patients also say, yeah, the eyes look great, but they feel a little lighter too.
So when you talk about functional versus aesthetic, so one thing that we see a lot here, we're having our consultation talking about eyelid surgery and rejuvenating those eyelids, and then their guest pops in and says, can you take a look at me? I just had this done 3 months ago or 6 months ago or a year ago. How come they didn't take more? Why didn't they take more? But what happens often is that patients go in, insurance is going to cover it, that's great. As you just said, they're going to have a cosmetic benefit anyway. We consider some of the oculoplastics or eye surgeons who are excellent surgeons performing functional surgery to be what we call ultra-conservative. Yeah, they're removing enough skin. Perhaps that skin is still close to those eyelashes and so forth. So you have your surgery done, and it's only later that you start to realize, well, geez, I don't know, they could have probably removed a little bit more. And so patients are coming back in. Do you find that at all?
Yeah, see it in that exact scenario. Oh, I just had my functional lids done by Dr. X, insurance paid for it. But boy, if they didn't tell me that, and I couldn't see maybe some faint scars, I'd go, you need your eyelids done again. But doc, I just had them done 2 or 3 years ago. Well, they didn't take enough out, and they're conservative. And I think they're biased in that they see patients as ophthalmologists who have dry eyes, and maybe they have dry eyes from too much skin being removed. So they're appropriately conservative, but the aesthetics of it sometimes aren't as aggressive as they could be.
Yeah, and I'd be careful with that word aggressive. Just I'd say I'm conservative, but they're ultra conservative. We don't want to scare people that it's too aggressive like Kenny Rogers. But walk me through your typical blepharoplasty in terms of, let's start with the surgery and then we'll go to recovery.
Right. So after we've evaluated them, surgery itself done in the office. I give them a couple milligrams of Ativan. Friend or family member drives them in. We've taken photographs preoperatively. We will mark them in the upright position for kind of inner and outer medial and lateral extent of skin excess.
And then go ahead and open, Dr. Mendelsohn. So now you shouldn't see the little marks because it's in the crease. Now go ahead and close, and then the marks reappear. So we know we've marked those perfectly.
And then we'll bring them into the suite. They'll be laying down recumbent, and then we'll mark them for the height. And so we all have a natural crease, some 1 centimeter, 10 to 12 millimeters above the eyelash line. We mark that, and then we simply just pinch with little toothless forceps the excess. It's just a little wedge. We're not causing the eyelid to open and the brow to come down, because at that point we might then close that incision and they have a tough time closing their eye. But once we've marked them, put a little Novocaine in, wait 5 or 10 minutes for that to set up, And the procedure from that point on would take me 20 minutes.
It took about literally 20 minutes once we had numbed up the eye. So we completed upper eyelid surgery, upper blepharoplasty, skin only. So Dr. Mendelsohn is wide awake. Patients will have the option of taking a little Ativan, etc. But he literally took nothing, so we did it under local. And the purpose of upper eyelid surgery is to remove the skin or the hooding. So he'll get a functional improvement, he'll see better, but also look better.
I don't give antibiotics for that procedure, and no pain medication for that procedure or any procedure I do. It's Tylenol. And boy, they do great, and they go, "Doc, best procedure I've ever had done." 90% of people, I bet, who do this, it will be once and done. It's basically a lifelong procedure for 20 minutes in the office.